You're listening to Smooth 98.1. Love music, love life. You are welcome back. It is time for Smooth Health on the Drive, brought to you by Evercare Hospital. And as always, on the show, we would like for you to engage with us, all right? So if you didn't know, well, of course you do know, it's the month of October. We're in the month of October. And of course, when you are in the month of October, you should know that October is dedicated to breast cancer awareness. All right. So today on the show, in recognition of Breast Cancer Awareness Month, we are going to be discussing breast cancer risk factors and risk symptoms and treatment options, to help us kind of understand the topic, what's going on. And to help us do that today, we have with us general surgeon from Evercare Hospital. So he's bestowed upon us his very, very heavy presence. It's Dr. Arinzechukwu Mosanya. Doctor, welcome to the show.
Hello, sir. Doctor, how are you doing today?
I'm good.
Great.
Welcome.
To be here.
Good to have you here, sir. If you just joined us, don't forget Smooth 98.1 is what you're listening to. Now, Dr. Arinzechukwu Mosanya, he is a consultant general and minimal access surgeon with extensive competencies in surgical oncology, especially of the breast and colorectal, surgical, gastro. Correct me when I'm wrong here now.
No problem.
Gastroenterology, right? And endoscopy. Also, management of surgical infections, management of abdominal walls, hernias and defects, and also minimal access surgery. Dr. Arinze has also keen interests in research in abdominal hernias, surgical infection, and surgical outcomes as well. And he's a member of the African Regional Group of Oncology and also an international cancer consortium which seeks to improve the cancer outcomes in low, middle-income countries as well. And he's involved as an investigator into ongoing studies that's designed at developing colorectal and breast cancer biobanks and database in Nigeria. Wow, that's impressive.
Very impressive.
And of course there are steps that are aimed towards providing quality data for system improvement.
Doctor, this is by far a very impressive resume.
Very
Doctor,
impressive.
welcome to the show.
Thank you very much.
Thank you so much for joining us. As always, you can join in on the conversation today. If you have any questions at all for our doctor about breast cancer, the risks, the symptoms, and of course treatment options, please join the conversation. Send us a WhatsApp message to 0809-444-0981. Again, 0809-444-0981. You can also call us up here in the studio on 01-448-9981. All right. I remember that our very first 3 lucky callers or texters that sends us messages on WhatsApp, they stand a chance to win a 10,000 Naira voucher courtesy our sponsors, Evercare Hospital. And that goes to your very first consultation at Evercare Hospital. So join us then. So, doctor, let's get started, shall we?
Yes, please.
So, being that it's Breast Cancer Awareness Month, for those people who really don't know much about breast cancer, because there's some folks who hear it but really don't know what it's about. They just know that it's breast cancer. Please tell us, what exactly is breast cancer?
Thanks, Judith, and welcome to our esteemed listeners. Breast cancer generally refers to the abnormal, uncontrolled growth or multiplication of cells found in the breast. And this multiplication or growth can lead to development of a mass, which colloquially referred to as a tumor. And if not checked or treated or removed, this tumor can then spread to the rest of the body, to other body systems, and it may eventually lead to the death of the individual. According to the WHO Global Cancer Report for 2020, breast cancer still remains the most common cancer in women worldwide, and more than 2 million cases are diagnosed. New cases are diagnosed yearly. Then bringing it home to Nigeria is still the most common cause of cancer-related deaths in women. And it's been said that about 30 women die on a daily basis throughout the country as a result of breast cancer. So when you look at that enormous statistics,
about 30 women die on a daily basis
in Nigeria.
Oh, wow.
From breast cancer. And looking at that enormous report, it then underscores the need for such advocacy programs like we are doing today. Some things are responsible for this alarming data with respect to Nigeria. Most of our patients present late, and we're beginning to see breast cancer in women that hitherto were taught not to have breast cancer. I mean, young women less than 50, as compared to the Western country where breast cancer is more of women above 50 years old, who are already post-menopausal. And this late presentation and this peculiar biology of breast cancers in Nigerian women are part of the reasons why we don't have very good outcomes as compared to the Western world. And that's what we are working on at the moment, to create awareness for people to get screened and detect the cancer early, then treat it while it's still early, so that survival rates can improve. Thank you.
Doctor, you mentioned something. You said there are new cases that are starting to arise in women that are less than 50, right?
Yes.
Could it be that, which segues into my next question, really, though. Could it be that it's because they don't know the symptoms?
My guess is...
And because you have to ask yourself this question, what really are the symptoms? People might not understand that their bodies are changing. So what are the symptoms for breast cancer?
Yes, Kayode, let me take you on the last statement you made. Most times, people, because of lack of information or ignorance or some funny beliefs, if I may use the word, or myths, may feel that certain things that they feel or see in their breast are normal. And that's why it could can contribute to the late presentation. But by and large, breast cancer can be asymptomatic. In asymptomatic, it means that the person may not even know that there is something happening in the breast and may have just gone for a screening program, and the doctor tells, we found something in your breast. However, the commonest presentation of breast cancer is a lump. So any lump in the breast is abnormal. That doesn't necessarily mean it is breast cancer, but it's very important that if you feel a lump in the breast, you should meet your doctor as soon as possible and have it evaluated. Other symptoms could be a change in the size, shape, or appearance of the nipple. So if you found that the nipple is inward drawn, or there's an ulcer or a wound in the nipple, or it's looking in a way that is not what it used to look like, that may be one of the pointers to breast cancer. Then patients may see a discharge from the nipple. A woman that is not breastfeeding should not have any discharge from the nipple, and is more worrisome.
Any discharge whatsoever.
Once you're not breastfeeding, you shouldn't have any discharge from your nipple. If you notice a discharge from the nipple, especially if it's bloody or cloudy or clear, that may be a pointer to breast cancer, and you should get your doctor to see you. Others may include change in the color of the breast, or a breast that suddenly becomes abnormally larger than the other breast, or if you notice that the skin of the breast is drawn inwards, what we call dimpling. Some people have dimples on their cheeks. So when you see such appearance on the breast is abnormal, it may mean that there's something ongoing there. And then for those who may not know, maybe out of ignorance, and the cancer has grown and spread, they may start having swellings in the armpits, which we call lymph nodes, or bone pain, abdominal pain, headaches, and a blurry vision. Those are cancers that have now spread to different organs in the body, and at that moment in time is really of grave prognosis.
If you just tune in, you're just in time. You haven't missed too much. We're talking about breast cancer right here on the Smooth Health on the Drive. And of course, we're streaming live on YouTube. So if you're out there, please tune into our YouTube page and catch us live. We're on YouTube. It's at www.youtube.com/smooth981.fm. So join us on there now as we are streaming live. All right, you can also join the conversation as well on our WhatsApp platform on 0809-444-0981. Whatever questions you have for our doctor, this is the best time to send them in, because you stand a chance to win 10,000 naira, and that goes to your very first consultation fee at Evercare Hospital. So, doctor, we're talking about breast cancer, and it sounds like when someone hears breast cancer, or even when doctors talk about, and when you go online to find more information, which I do not advise anyone to do, what happens is you see more women. So is this a gender-based, disease, or is it, can men get breast cancer?
Well, breast cancer can actually affect men, though not as frequent and as common as it does in women. And of course, for every man that has breast cancer, you definitely have 100 women. Also,
for every one man that has
breast cancer, about 100 women. But if a man has breast cancer, it's most likely there is a genetic problem in his setup that predisposes him more to have breast cancer. And you may tend to see that there may be a genetic problem running in the family, what we call familial breast cancer, and that may be the reason why the man is having breast cancer. And we advocate that if any man has a breast cancer, he should, as a matter of priority, get members of his family to also be screened. Maybe there's a genetic problem predisposing him to breast cancer. It sounds counterintuitive because people will say, do men have breasts? I mean, but
some men have breasts.
Men have breasts.
So we do have breasts, but then the amount of breast tissue is definitely smaller than what you see in women. And if you recall that breast cancer has a hormonal component, which is the estrogen, and this seems to be much smaller in men compared to women. And of course, men don't breastfeed, so we don't have the cyclical changes that occur in the breast. So maybe that's one of the reasons why it's quite rare, but it does occur. And because it may be diagnosed late, they don't tend to have very good outcomes compared to women on the same stage.
All right. If you just joined us, by the way, don't forget Smooth Health is what you're listening to. It's 5:30 by our time. We'll be going on a quick break in a few more seconds, but you can be a part of our conversation by calling the studio lines, okay? Call the number 0144899981, or better yet, just send us a WhatsApp message so you can get your thoughts out clearer, in a better way. Okay, so send your WhatsApp messages to 0809444091.
So, doctor, we've talked about both whether it is a gender-based disease, we talk about the symptoms, but who is at risk of breast cancer?
Thank you. The breast cancer had some certain risk factors that may make an individual more susceptible to having breast cancer, but which is also worthy to note that up to 70% of women who end up developing breast cancer may not have any of the identifiable risk factors. And this is the reason why we advocate for regular screening. And that's about the only way we'll be able to identify these tumors when they are still very small and confined to breast. But by and large, there are certain risk factors that we refer to as non-modifiable risk factors and modifiable risk factors. The non-modifiable risk factors are things we can't change. I mean, for the fact that you're a female, you have a 1 in 8 chance of developing breast cancer in your lifetime. That's about 12.5% risk. Not that you will have,
but 1 in 8 chance.
1 in 8 chance that you may have breast cancer in your lifetime. And
this cuts across to all women.
All women, yeah, worldwide. So, and that's a scary picture, quite all right. But we also remember that this is chance and probability. It doesn't mean that the person will develop, but bearing that in mind, you should have your breast checked when you approach the age of screening for breast cancer. And of course, commoner in women.
Sorry, say again, what's the age for screening?
So generally, the cutoff to start screening for breast cancer is once you have attained reproductive age, so called age 18. So once you start age 18, you should get yourself screened. So there are different periodicity, so to speak, of this. So between the ages of 18 and 50, is that advocated that you go for your screening every 2 to 3 years. So, but then from 50 and above, you should have your breast screened every year or every 2 years, depending on which guideline you are following, whether you're following the British guideline or the American guideline. For 18 to 40, you should have the breast screened using ultrasound or mammogram, because at this age group, the breast has more glandular tissue, so it's firmer and has more of the glandular tissue that produce milk around this period. And the mammogram that we use for elderly women may not identify any lesion or any breast pathology as much or as well as the ultrasound would do at this age group. But once you're from 40, 50 and above, where the breast is now being replaced by fatty tissue as the woman approaches menopause, then you should have a mammogram done every 2 to 3 years. Thank you.
All right. Doctor, well, this has been quite insightful, but you know what? Let's take a pause here and go on a quick break. When we get back, we'll do some more talking. Ladies out there, we'd love for you to call us, and also the gentlemen out there as well. Please call us, and let's have that conversation on 0144899181. This is Smooth Health on Smooth 98.1.
This is Smooth Health on the Drive.
A global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria. This is Smooth Health on the Drive.
A global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
You're welcome back. And you're welcome back. You're listening to Smooth 98.1. Love music, love life. It is, of course, Smooth Health on the Drive here. And my name is Judith TB. And, of course, Kaide is here as well. Kaide Baker. Kaide. And, of course, our doctor, very own doctor, general surgeon at Evercare Hospital is Dr. Arinzechukwu Mosanya. Doctor, welcome back. We're talking about breast cancer awareness today. The risk, symptoms, and treatment options available for breast cancer. Join the conversation. Please send us a WhatsApp message to 0809-444-0981. You can also call us up on 01-448-9981 if you have any questions at all for our guest today concerning breast cancer. Please go ahead and do so. Send us those messages to 0809-444-0981. And we're streaming live on YouTube. Okay, so please join the conversation on YouTube. We are at Smooth 981 on YouTube.
All right, so doctor, so we've talked about quite a number of things. We've talked about symptoms, we've talked about what breast cancer is, and people that are at risk of breast cancer. So I want to talk about, the time it takes now. How long, right? How long does it take, to develop breast cancer? How long does breast cancer, you get what I'm trying to say. How long does it take to develop breast cancer?
Wait, hang on, I think we do have a call. Let's see who that caller is. Hello? Hello?
Hello.
Hi. Good evening.
Good evening. Is that Smooth FM?
Yes, this is Smooth FM. Your name, ma'am?
Okay, my name is Bisola.
Bisola. Would you like to speak with our doctor today?
Yes.
Go on. He's listening.
Hi, Bisola.
Hello. Thank you. Well, I quickly just want to find out something. I've had one or two tests done, but I'm still not kind of satisfied. I don't think I have cancer, but what I noticed is that I have fluid coming out, and it is darkish in color. But when I had those tests done, they said there was nothing. And I think I still did one about 2 years ago, and they're still saying nothing. But I'm just worried, how can I be producing milk with a darkish in color? Not all the time. I will have to press out to see that, like a pot or something, but they keep saying there's nothing. So I want to know, is it possible that one can be producing such once in a while and they're saying there's nothing like cancer?
All right. Thank you so much, Bisola. The doctor is going to answer you now. Join the conversation on 01-448-9981. Again, 01-448-9981. Doctor.
Thank you, Bisola. I would have loved to get more information from you, but it's possible that you may have some discharge from the nipple and not have breast cancer. I would have loved to know your age and if there are other symptoms that you may be developing. But may I suggest that you take a trip to Evercare and get an appointment to see either the oncologist or the breast surgeon, and we can take it off from there. There may be some additional investigations you may have to perform to adequately describe and define what may cause the discharge from the nipple, and so that your mind can be at rest. But it will be a good thing to come around and let's evaluate you. Thank you.
All right, I think we have another call. Let's see who this is. Hello, good evening. Hello, good evening.
Hello, good evening. It's still the same. I'm Bessela again.
Okay,
but
Bessela.
Great.
I'm going to be 50.
Oh, all right.
And I don't feel uncomfortable or anything. I still feel okay.
Okay. Bisola, that's fine. We're on air, so there are some other questions I maybe on may not be ideal for me to ask you over the air. But can I suggest you pay a visit to the hospital so that we could discuss face to face and get you reassured that you may or not have breast cancer?
Yes.
Bisola, we're going to give a voucher to you because you are the first caller. So that voucher gives you the access now to go to Evercare so you can have this conversation with the doctor there. So please send us your details. Send them to our WhatsApp platform, which is 0809 444 0981.
Yes, indeed. So, doctor, before the break, you were talking about the risks of this disease, one of the risk factors.
Yeah.
I noticed you haven't finished on that, so please go ahead.
Yes, exactly. So, quickly, increasing age also predisposes a lady or a patient or an individual to have breast cancer. And breast cancer is commoner in women who are in the postmenopausal period. So, you've completed the menstrual cycle, you've completed your family. That also predisposes the individual to have breast cancer. There are some types of breast cancer that are known to have genetic predisposition. So this tends to run in families and also tend to have poor prognosis. A lady that has not given birth is at increased risk of having breast cancer. And there are certain lifestyle attributes and behaviors that may increase your risk for breast cancer, such as if you're overweight or obese, if you're not active, living a sedentary lifestyle, if your diet is poor with a lot of fat in it, and if you are usually stressed and anxious. Well, these are not being well defined, but we'll find out that patients with breast cancer tend to have some of these lifestyle features in them. Of course, smoking is a major carcinogen. That's a substance that can cause cancer and is been known to increase the risk of breast cancer. And of course, women that may take alcohol in an unsafe limit, so to speak, may also increase the risk of breast cancer. Thank you.
Wow. Doctor, thank you so much. Join the conversation on 014489981. Again, 014489981. Send us those WhatsApp messages to 0809 444 0981. This is Bolaon. He goes, hi guys, please can the MD talk about some self-examination women should do in front of the mirror daily prior to annual examination?
Yes, thank you, Bola. It's advocated that every woman of childbearing age, that's from 18 years and above, should have what we call the breast self-examination at least once every month. It's best to choose a period in the month that you can reproduce month in, month out. And there are virtually 3 ways you can do this: in front of the mirror, or lying down on the bed, or even when you're having a shower. First of all, you can raise your hands up slowly while facing the mirror and watch for asymmetry. So watching the breast on the mirror to see if there is any change or difference in the sizes or any abnormality you can see. That's for the observation. And then to feel the breast itself. So if you want to examine the right breast, you put your right hand over your head and then using the left hand to examine the right breast. So you go either in a circular manner, inwards, outwards. That's from inwards outward, meaning from the center of the nipple outwards in a circular manner until you end up in the armpit. Or you can do what we call the radial examination, where you start from the nipple and go outwards radially in a radial manner. This way, pressing the breast against the chest wall and rubbing the breast with the pulp of your fingers. This will help you to identify any irregularity like a lump or an unevenness, and then at the end gently squeeze the tip of the nipple to see if there is any discharge, and then finally put your hand under the armpits to check if there is any lymph node. You repeat the same sequence for
the left and the right.
The left and the right, yeah.
Wow.
All right, doctor, I'm sure a lot of people are itching to know this. Is breast cancer preventable?
Definitely. And like any other disease, there are preventive measures that can be taken to either reduce the risk of breast cancer or identify the breast cancer at an early stage so that adequate treatment can be offered. And this kind of belies the advocacy that we are propagating now, which is that early detection save lives. So if you adopt certain risk reduction measures as well as screening of the breast cancer, you'll be able to identify these women early and offer them the treatment. So generally, I would like to say that there are about 5 key preventive measures that can be utilized. The first one is screening and surveillance. So I've spoken already about the self-breast examination. Second component of that screening is to have your 2 to 3 yearly ultrasound if you are less than 40 years, or 2 to 3 yearly mammogram if you are both 40 and 50 and above. And then if you notice any abnormality in your breast, let the clinician examine. The second risk reduction factor include lifestyle modification. So quit alcohol, quit smoking, be very active, exercise, and live a healthy life. Eat fruits and vegetables and certain protective vitamins. And then for reproductive health, is advocated that women should space their children, their offsprings adequately, and of course breastfeed their children appropriately, as this has been known to protect the individual from developing breast cancer. There's a lot of hormonal interplay during the childbearing age, and these are very important in breast cancer. And of course, there are certain types of breast cancer that certain medications may help to prevent. So we call this chemo prevention. So, but of course, this will be discussed with you by your doctor. And then the extreme form of the spectrum are those who have very high risk for developing breast cancer. These people may be offered what we call prophylactic mastectomy. So you remove the breast even before the breast cancer develops. And
that is a treatment option?
That's a treatment option, actually. What is preventative because the person has not yet developed the breast cancer.
Okay.
I mean, case in point was the case of Angelina Jolie, who has a very strong genetic problem in the family and had to take out her breast even before she developed the breast cancer. But these are discussions that you must have with your oncologist and with your surgeon. Thank you,
Doctor. Very heavy topic we're discussing. If you're just joining us, we're talking breast cancer because it's in recognition of October being the month of Breast Cancer Awareness Month. And of course, our doctor here is Dr. Arinzechukwu Mosanya. He's a general surgeon and is just helping us shed light on this topic and better understand it, for everyone out there. So if you have any questions for our doctor, please join the conversation on WhatsApp on 0809-444-0981. Call us up on 0144-89981. Stream us live. We're also on YouTube at Smooth981 on YouTube there. Go check us out live. So doctor, we've talked about preventive, and everything else, and some people would go the extreme miles, or I wouldn't say extreme, but would go all the 9 years in the case of Angelina Jolie and take out their breasts. But can it be treatable? Breast cancer, can you treat it? And what are the treatment options available at Evercare Hospital?
Thank you, Judith. Breast cancer is very much treatable and I dare say curable, potentially curable if identified early and appropriate treatment offered. However, the determinants of the type of treatment you have will depend on the person's age, the size of the tumor, and whether the tumor is confined to the breast or has spread to the rest of the body. The biology, so to speak, or the specific type with respect to genetics of this breast cancer, as well as the person's reproductive history, if she has completed her family or intends to still have more children even after treating the breast cancer, and then the person's general health status, and of course the person's choice. Some people will say, I don't want the breast anymore, please take it out, or I want the breast, can you treat the tumor? And these are discussions that you have to have with your oncologist or your surgeon. So at Evercare, we have the breast cancer multidisciplinary team consisting of the breast surgeon, who's the general surgeon, that's me, and the clinical oncologist.
Of course, that's I was just going to jump in. Isn't that you?
The clinical oncologist, the oncology nurses and pharmacists, of course, the well-experienced patient care services and concierge team. And of course, I will also have an oncology unit where the counseling will be done, as well as those who have need to have chemotherapy will be administered in the best comfortable and conducive environment. So the evaluation process will start with you presenting to your doctor, whether a general practitioner or to the general surgeon, and then an evaluation of your symptoms and clinical examination will be performed. In some instances, a small piece of this tumor may be taken. We call this a biopsy, and this is to confirm the type and the characteristics of the breast cancer, because before you start any treatment of any cancer, you must have
what you're going after.
What you are going after. Thereafter, we will now go to the staging process. So the staging process is to find what stage this tumor is. So usually about 5 stages, 0 to 4. Stage 0 means it's still confined to individual cells in the breast. While stage 0 is like confined to individual in the breast. While stage 4 is like to spread to the rest of the body. Of course, you can now know from 1 to 2, 3 at different levels of spread. And so investigation-wise, we have all the facilities to stage this disease. First like CT scan, 1.5 Tesla MRI, and a nuclear medicine department to offer a holistic care on this patient. Thereafter, there will be a multidisciplinary meeting with a clinical psychologist, because these are very
important conversations
that you must have with the patient and caregivers. So the clinical psychologist will be there to offer all the support that's needed, and the counseling process is quite robust and extensive. After that, a treatment plan will then be formulated for the patient. This will include removing the tumor and reconstructing the breast, which we'll call breast conserving surgery, and these are reserved for people at early stages of the disease, like stage 0 and stage 1. For those at the later stages of disease, they may need to give you chemotherapy to be able to shrink the tumor and reduce the spread to the extent that it can now be treated. And radiotherapy may also be required at certain points in time. And then if the tumor is also responsive to hormonal manipulations, such patients may be given some anti-hormone medications that may help to treat the cancer.
All right, thank you so much, Doctor. It's been wonderful having you join us today on the show. If you're just tuning in,
where have you been?
You missed. But it's on YouTube, by the way, so you can catch a replay after this. But Doctor has been talking to us about breast cancer because just in recognition of Breast Cancer Awareness Month, we've been talking all about breast cancer. With us is Dr. Arinzechukwu Mosanya. He's a consultant general and minimal access surgeon with extensive competency in surgical oncology, especially of the breast and colorectal, as well as surgical gastroenterology and endoscopy, management of surgical infections, management of abdominal wall hernias and defects, and minimal access surgery. And Dr. Arinze has, keen interest in research in abdominal hernias, surgical infection, and of course surgical outcomes. So he's the best person to, just give advice on breast cancer. But doctor, before we let you go, please, how can our good listeners reach out to you, and of course to Evercare Hospital as well?
Okay, just a quick one. We are located Evercare Hospital is at Lekki Phase 1, number 1 Admiralty Way, Bisola Durosimieti Drive, Lekki Phase 1. And you can, if you have any information you need to send across, you can send out an email at info@evercare.ng, and you can also visit our website www.evercare.ng. The front desk telephone is 081-398-50710. And let's remember, early detection saves lives. Thank you.
All right. Thank you so much, Doctor.
Saves lives.
Like he mentioned, you can reach out to, of course, reach out to him and also the good people at Evercare on the various platforms he's mentioned. First things first, if you own a smartphone, maybe you should check out the website first, www.evercare.ng. If you've got questions, reach out to the good people at the customer service desk, 081-3985-0710, and or just send an email, info@evercare.ng. And if you want to drive through, it's very easy. It's a straight drive through. Number 1, Admiralty Way, Bisola Durosimi Edzi Drive. Lekki Peninsula Scheme 1. Lekki Peninsula Scheme 1, yeah. That's Lekki, Lagos.
All right. Guys, thank you so much for joining us on the conversation. And Bisola, please, our caller today, please send us your details to our WhatsApp platform. It's 0809 0809-444-0981. Again, 0809-444-0981. Send us your full name, your telephone number, of course, your email as well, so that we can send your details to the good people at Evercare so you can redeem yourself of that voucher. And that brings us to the very end. Stick around. Smooth Drive continues on the other side. Don't go anywhere.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every
of cancer.
Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.
Smooth 98.1.